Hi, thank you so much for choosing to be with us for this session. Really appreciate it. I think the importance of the area that we're about to discuss, can't be underestimated, and I'm delighted that you chose to be with us. My name's Mike Farrer. I'm the chair of UK Active, but I also have a long history as a chief executive of the National Health Service, where I ran a number of strategic health authorities, and I was also appointed, I think I still may be actually, because I was never told I'd stopped, as the National Tsar for Sport and Health and Physical Activity by Andy Burnham back in 2009-10. So long history around this agenda, and I'm absolutely delighted to be able to sort of chair this session at a time when I think the understanding and the application of the knowledge and the insights we're going to discuss today at scale for a whole population, as you've already been talking about, is more vital than it's ever been coming out of COVID and seeing some of the huge challenges that the National Health Service and care system faces, and indeed the workforce issues that we see right across the board in voluntary sector, all the way through to our sort of experts in consultants in hospitals. So a great opportunity to talk about physical activity and its contribution to a healthy life, and its ability to give people a huge amount of satisfaction in terms of their social, physical and mental well-being. Just by way of structure today, what we're going to do, I have four wonderful guests who will introduce themselves, but we'll get into discussion with them. I've asked each of them to just give us some introductory thoughts, and that'll be about 3 to 4 minutes. And then we'll have plenty of time for discussion and questions. If you'd like to ask questions, you can log on to Slido, and they will come up on a little device I've got there, so I can ask you questions for you. But if we can't get through that way and you do want to ask a question, we'll try and find you in the audience. And again, for those of you who are joining us live on stream, thank you very much for joining us, and hopefully you'll gain the insights into the discussion that we have in the room. So just by way of setting the scene and being slightly controversial, I think the evidence of keeping active in whatever shape or form that means, whether that's the mobility of walking or even standing. We know Michael Moses' work on standing that was actually attributing 3 minutes of standing every hour to the potential of effectively running 3 marathons a year in terms of its value. That there are so many things that we can do to stay active. We also know that activity can be done as individuals, or it can be done in collectives, and I think particularly about young people's lives, and as people get more isolated in their older years, that actually the value of being part of a collective shouldn't be underestimated either. But we know the evidence, and it increases daily, that says that the value of being physically active in terms of cardiac, in terms of mental health, in terms of cancer outcomes. You pick me an area, and I will provide evidence that the value of activity and keeping active is going to have some benefit to you, whatever condition you might have. And clearly, if you can maintain your well-being for longer in terms of avoidance of any kind of condition or disease, even better. So we know the evidence is there, and we've known it for some time. But frustratingly, the ability to go at scale in terms of physical activity offer and a healthy population has somehow missed in the night, and we've not got the at-scale benefits of being a hugely active nation that we perhaps could find. And so it's slightly frustrating, if you like, to stand here today and say what we're going to talk about today is how do we convert our knowledge of the opportunity and benefits of physical activity throughout your life. How do we convert that into funding streams to generate extra service offers, extra community engagement pieces, extra ability for you to keep yourself active in your own home, and how do we really get that through? And I have a hypothesis which we're going to test, which is that we've largely made the argument, those of us who work in the sector, of really being keen either through public health or being a provider of the opportunities to keep people active and to engage with people about their own active lives, we've largely focused on the primary prevention message. And of course that's wonderful, because it really is true that if we were a healthier nation, we would have significant benefits in terms of drawing the resources on the states. And this is where UK Active's mission of 5 million people more active chimes very much with the idea of 5 more years of independent, and I would argue, active living. And so we have common purpose. But actually that jam tomorrow often fails to meet the challenge of, when you're a busy chief executive, or you are inundated in your hospital or your GP practice, or indeed in your community group with demands for time and effort, the opportunity to sort of like bring today's resources to bear on this challenge are always something you'd like to do rather than you must do. And I think what we need to do is to convert that message, not just of primary prevention, but of secondary prevention, into this is something that if we really look at the health of our workforce, where we are massively paying for additional labour at premium rate costs, if we can keep our workforce healthy, we have an ability to immediately impact on the bottom line of organisations, not in 10 years, but now. Andy Haldane, the ex-Monetary Policy Committee member, said that the biggest barrier to economic recovery in this country is the health of our workforce. But I also move into these areas of waiting. We now have significant numbers of people waiting, arguably over 7 million, at least 5.5 million when you look at people who are waiting for more than one procedure. People who are waiting now a considerable amount of time and deteriorating their health and outcomes as a consequence. And yet we know that by keeping active, people are able to manage their condition better, be better fit for any intervention when it does arrive. But equally, we know from things like the work on musculoskeletal hubs that actually, if you can be active whilst on a waiting list for hip and knee, we know something between 15 and 20% of people, because their mobility improves, their pain reduces, can actually come off that waiting list and avoid surgery at all, which has a huge impact on those in-tray issues. We know from cancer, for example, that later stage presentation as a consequence of COVID means we're getting poor outcomes, but we know the benefits of staying active whilst in cancer treatment and preparing for cancer treatment can compensate for some of that delay in treatment. And we know from a young people's point of view, in terms of mental health, we know that people coming out of COVID who've been isolated, being more active together with their friends and family can have a big impact on their mental health and status, and impacting on things like depression in younger people, young males, and things like eating disorders, etc. So the evidence is there. The challenge is, which we're going to explore now, is how do we get it over the line? How do we connect to the in-tray? How do we start bending this resource? And how do we use that to put an underlying platform of population in place that will ultimately deliver in later years as we get older and we are effectively able to live more independently as a consequence. So as I say, thank you so much for joining us. I'm going to chair my panel, and I'm going to pass on. Each of our panelists will say a few words, some from the podium, I think, with slides. Others might stay where they are, just to give us a sense of their take on this business, and then we'll get into the conversation. Okay, Ben, over to you.
Thank you very much. So I'm Ben. I'm the CEO of Good Boost. We're a social enterprise, and our focus is about transforming existing community spaces into therapeutic self-management places. And we work with gyms and pools majority, but they're also being delivered in libraries, in faith spaces, so we can add new health, well-being, and physical activity options in the local community. And here's a short video that will do a better job than me at giving an idea of what we do and how we work.
So some of the risks of not getting care include a risk of increased pain-related disability, social isolation, psychological distress, and a loss of work. So it can be a challenge for people to receive care because waits for NHS services are often very long, and the legacy of the pandemic has impacted those further.
The innovation is AI technology, which has been NHS certified to create individually tailored therapeutic exercise programs for a wide range of joint conditions that evolves and adapts to them based on their feedback. The other innovation is the hardware we've developed, creating bespoke rugged tablet computers to deliver this software in swimming pools, in studios, that's waterproof and can be dropped as well without any problem.
I like that it's tailored to each of us and we can go at our own pace. It's really good to have a visual of the movement. asks you lots of questions, and you can see how your answers have affected, what comes out in terms of the suggestions of exercises.
I'd say I don't know what I'd do without Good Boost. I went to the physio at Shakespeare Road. They told me the pain in my hip, they couldn't do anything for me because it's due to the stroke.
I was to have operation in December, just before Christmas. And when I went in, I was all prepped and everything. And when they examined me, they said that I didn't need to have the op. They cancelled the operation. I didn't have it done that day at all.
I think leisure centres are perfect for this service because they're right in the heart of our community. People have access to them, everyone knows where they are.
Having a service like Good Boost that we can put into the community is a significant step towards reducing some of these health inequalities.
It's stopped making me feel isolated.
That was a big win for a start. The normalisation of my condition, and then more importantly, be on top of the condition before it's on top of me.
Thank you.
We noticed the Alfred Hitchcock appearance at one point just on the back of that video. Okay, I'm going to come to Adrian next. Your thoughts, Adrian?
So,
you should introduce, sorry, I was letting you introduce yourself.
It's okay, Mike, thank you. So I'm Adrian Leather, I'm Chief Executive of Active Lancashire. We're a charity and we're a company limited by guarantee. We're part of the Sport England family and we're primarily about getting people physically active. But our focus over the last 10 years has been around tackling inequalities. And in Lancashire, we've really made that connection between health and productivity. And we've been using our partnership with Innovate UK and UKRI and our European funding to really get into understanding the challenges faced by SMEs, particularly SMEs, about workplace health and the challenges of retaining particularly older workers and ensuring that they're good for your business. So the work that we've been doing is working with employers to support them, to enable them to have workplace health champions, train members of staff within their staff teams, which have been particularly giving them the skills and the capability to have conversations about what good health actually means. And to support them with those linkages so that they can access opportunities in their communities, whether it's everything from walk and talk sessions at lunchtime or getting links across to the healthy weight services within our leisure centres and our communities, access to other partners that just can support them around things like mental health and well-being. But we've also been working with individuals, and this is where the Innovate funding comes in. So we've worked with UCLan, University of Central Lancashire School of Medicine, and we've been able to get our leisure centres up to speed and with the skills that they needed to actually undertake the over 40s health check. And we know, going back to that inequalities piece, that people who are from the lowest socioeconomic backgrounds are least likely to access primary health care to do the health check. And even if they get that information, they're not cognizant of what it means and how it can make an improvement to their quality of life. So we've been working with the employees and the employers to have that empowerment conversation and link people up using conversations around making every contact count, which is a very empowering conversation, to link them with the opportunities in their community. And what does this mean? Well, on a system level, and that's where we've been working, we know that Lancashire's economy is worth about £30 billion. We know that around about 28.5% of Lancashire's working age population are economically inactive and unemployed, which is a crazy number, isn't it? It's knocking £3 billion a year off Lancashire's economy. And we know that the approaches that we're putting in place with the SMEs, which are over 90% of the employee base across Lancashire, that's the mechanism. If we can get this approach scaled up, it's going to be the mechanism to tackle those inequalities around health within our communities, but also build the level of productivity that we need to see so that Lancashire is becoming more competitive as an economy and more sustainable as a county and local communities. And that's what we're trying to achieve. And physical activity is the best fit, most accessible tool to achieve that. So we've been working on an individual level and a system level to build supporters to achieve that. And that's the partnership that we've been putting in place over the last 3 years.
Thank you, Adrian. Okay, I'm going to come to Daniela. Could you introduce yourself and give us your sense of your contribution and what you're thinking at the moment, Daniela?
Yeah, of course. I had some slides prepared, but we're changing the dynamic, so that's absolutely fine. So my name is Dr. Daniela Beivide. Oh, there you are. Cool. I'm Chief Science Officer at Holy Health, which is a fully digital self-management tool for physical and mental health. And in partnership with HUK, Lewisham and Southwark, and as part of the Healthy Aging Challenge, we co-created this service with older adults for healthy aging needs. Should I change the slide somehow? Nice. Oh, next slide. Yeah, cool. So, I mean, just a little bit, to go a little bit back, thank you, and to answer the question about scale. So the way that we've been distributing Holy Health is primarily through the NHS, through primary care. So we're partnered with over 150 GP practices already. And that's a great way to reach entire populations at a low cost. And even though we provide holistic support, so across physical and mental health, physical activity is one of the key pillars of what we do. So we do that in the sense of we're sending people nudges to do small but impactful habits that they could do at home. But we also have accessible content, so we can see some seated exercises. We have some intergenerational content that we know that's really impactful for older adults. And a new, is this the next slide? Oh no, a new feature that we did this year was the community feature. So we know it's not just about having a phone, it's also about engaging. So what we do is we kind of inform users of what's out there outside of Holy Health so they can be active and engaged in the community. So we've partnered with a few great organizations like Ramblers and the Royal Voluntary Service. So we kind of suggest things like well-being walks and online classes. So there's one called Laughter Yoga. Apparently it's a thing, and people are loving it. And we're seeing that people are really, really seeing the results. So they've reported that they feel great. They have, they've managed their pain better, for example. They have more energy. And we can see that in numbers. So the most recent analysis that we did with people over 50 who had an MSK condition when they joined the service, people who had kind of low to medium baseline levels showed that after using Holy Health for 8 weeks, they had a 20% increase in exercise, 15% more self-confidence, 17% increases in self-management skills, and 30% of them reported that they needed less GP support after using Holy Health, and this is after just 8 weeks. So yeah, these results actually mirror what we see in our entire population, which we've supported over 30,000 people already, where people are reported just managing their condition better, increases in life satisfaction, for example, by the ONS4. And yeah, we think this is a way forward to not only help people manage their conditions better, but also to prevent them to getting there in the first place.
Thank you, Daniela. Last but certainly not least, and you'll notice that we don't have Layla with us, who was not very well, unfortunately, today, but we do have a fabulous substitute, Anna. Anna Dixon. Anna, do you want to introduce yourself?
Yeah, thanks very much, Mike, and it's a pleasure to join you all up here. I work now as a consultant, but I've been very involved with the Healthy Aging Challenge and a member of the advisory board. So it's fantastic to be sitting here with some of the success stories, having sort of embarked on shaping the challenge when I was Chief Exec at the Centre for Aging Better, and really pushing to make sure that as part of the Healthy Aging Challenge, physical activity was one of the domains that we wanted to encourage and see businesses and social enterprises developing. So it's brilliant to be hearing some of the examples of the fruition of those investments. And really recognising, so we, as Mike says, we know the evidence base. So this was work that was done by the Centre for Aging Better, commissioning again updates of the evidence base that informed CMO's guidelines on physical activity, really making sure that we understood the importance of strength and balance, as well as the heart health aerobic exercise, and also preventing sedentary behaviour. So you know, we've known that for a while, haven't we? So the key was, how do we actually reach people with interventions that are evidence-based, that are going to make that difference? And it's great to hear examples of how that's happening. And I think what I really take from this is the success of partnership. We've been hearing that as a bit of a theme from the conference. But how we're bringing together players in the voluntary and community sector, people with lived experience to do that co-design, people who've got amazing sort of tech knowledge and backgrounds, the research community in terms of evaluation and informing it, but also the leisure services. So seeing people in swimming pools, in gyms, using those amazing community assets, they're there in most of our communities, and how we can harness those community assets to really benefit more and more people. I've been a bit on my own journey this year, so I was experiencing a lot of joint pain. I've subsequently been diagnosed with osteoarthritis. Somewhere in the middle of that, I experienced a stress fracture in my femur. So I've sort of gone through that. And my contact, I'm afraid, you know, with the health service was brilliant in the terms of, you know, getting me an X-ray, an MRI, and so on. But once I was being then told, right, this is what you've got, whether it was the MSK clinic or the orthopedic surgeon, it was a little bit like, well, this is what you've got, off you go, and we hope we won't see you for 10 years when you might need a hip replacement. Well, thanks very much. So, you know, how someone like me is supported then to be able to live as pain-free as possible for as long as possible, managing effectively that chronic condition now, you know, like many people in their 50s plus, my first experience, I suppose, of ticking one of the chronic condition boxes. So I think that's what we're hearing today, is how do we bring that partnership together with the NHS? And I think that's one of the challenges we can maybe talk about. You've obviously had experience of linking up with GPs, but, you know, how do we also get those links into secondary care, whether it's orthopedic surgeons or specialist MSK clinics, to make sure people like me who are getting these diagnoses are then not left on our own, but are being supported to remain physically active, to actually have that secondary prevention, where we know there's huge benefit to staying in work, which I think is the other big message of these projects, is this is a lot about working age. We hear about economic inactivity in the 50 plus. We know that MSK is basically the leading cause, along with mental health, and we know that physical activity can benefit both of those, as we've been hearing, both mental and physical, and those social and well-being effects, as well as the physical benefits, are so key. So I'm really excited by the projects, and great to be part of this conversation. Thanks, Mike.
Thanks, Emma, and thanks all of you for keeping those comments brief, because we do have quite a bit of time. I suppose the one thing that I'm struck by, and it's not just today, but we have some fantastic examples, some of them in pilots. I almost kind of look at it and think we have some beautiful jigsaw pieces. And the trick is really to get systematic application of that at scale, which again was a theme of the earlier morning sort of work at the conference. When you think about it, do we have an opportunity with the sort of integrated care systems coming along now, or even with working at place, where health and local authority, but also with colleagues from primary care, voluntary sector, etc., could be party to that? When you think about from your perspective, I guess, do you see that as a route to scale? And if not, how do you think we can take to scale? I'm going to ask all of you on that point, and then perhaps we'll be a bit more specific with some of the questions. So I'm going to start with you, Ben. You were very short in terms of, so from a Good Boost point of view, what does scaling look like from your point of view, and connecting to those kind of structures now in health and care?
So scaling for us is exactly as what Anna said about utilising those existing community spaces. So we do work with NHS teams, and a lot of that has been working through the MSK Hubs programme. Again, what was mentioned about working in partnership, we work with UK Active, OR UK or Escape Pain, Arthritis Action, to create this package to go into these spaces. So we do have NHS teams referring in to our MSK Hubs and Good Boost and Escape Pain in leisure centres. The challenges at the moment for our scaling to be adopted by ICSs or NHS at scale is that often the conversation between either the local authority or the leisure services team are not speaking to the NHS trusts. We've had to work really hard with UK Active as well to give leisure centres and the teams that run them the knowledge, the confidence and skills to go out and speak to these departments to create their own pathways. What there needs is more universal adoption of community spaces as being the front line of community services for health and well-being, the front line of supported self-management. There is still very much a perception, and it's frustrating when we go into meetings with physio and MSK teams, that they are the service to create prevention treatment. And there's still a perspective, a cultural shift needed with clinicians to view community services as not taking away their role within health in the health system, but as a tool to be added to it to reduce the burden and pressures within the system, but ultimately to improve health outcomes for older adults in our case, but people living with a wide range of health conditions to better support and manage their health.
Thanks. And Daniela, in terms of scale, and interesting that there's been a big investment in virtual wards, but largely about bringing people out the other end rather than preventing going in, I guess. I'm wondering whether or not that sort of like those streams of funding that come out around the virtual digital health offer perhaps is still focused too much on the treatment end as much as the kind of prevention, particularly secondary prevention, I guess. Thoughts? You know?
Yeah, absolutely. So, yeah, I mean, the way we do scale is, being a tech company, is very cost effective. So obviously human services are hugely important, they're vital, but they do have a scalability limit. So that's where we come into place to support that provision of services and give some support to people who really need it. So the idea is to go to those ICS level conversations and be like, okay, we can provide this. But obviously the funding is not there yet, and as you say, if it is, it's for very specific niche problems that are already happening, rather than looking back and say, okay, how can we prevent that from happening, and also how can we provide support to a wider problem, maybe not just the niche, siloed issue, but something that can support many things at the same time. So that's how we see scale and just kind of in a holistic way, giving people those tools, and they can take that supported self-management to the next level, where they can really just have it in their pocket, feel empowered to do something, and also working in collaboration with in-the-ground real service. No, they're all real, but in-person services that can also make a difference.
And I think coming at that from the consumer at scale offer, you know, is part of that. I'm going to come back to Anna on the role that these integrated care boards, place-based partnerships might be able to play in terms of kind of overarching, particularly working with our active partnerships. I mean, do you see opportunity around that kind of level of engagement?
I suppose I'm a little bit more distant from it than I was when I was very much working with the NHS. But I guess I have a degree of skepticism from past strategic reorganisations that actually a lot of the spread doesn't happen top down, it does happen bottom up. And so I think those local partnerships, place-based partnerships, whatever, are at a better scale. So whether it's bringing together the local authority leisure, any public health teams, you know, with primary care networks, I think probably at that scale in a locality, there might be more opportunity to, you know, build those partnerships to standardise the offer for that population. And what I would then hope in time is, once those places are really demonstrating the benefit, that's where the ICB can come in and say, actually, we feel that this is working so well in this one part that they can then say, actually, we should standardise this across the whole patch. But I think that's going to come bottom up rather than top down from my experience of strategic commissioning from the past. So I do think those local partnerships and increasingly seeing the wider community assets, including leisure, as part of that sort of solution to a place-based approach. Indeed, working, you know, with partners across into employers and so on, that's more likely to happen at that footprint.
Thanks.
But you may have
Adrian, I'm going to just combine my question with you with a question we've got from the floor, actually, which was about sickness absence, again, being at such a high level, I think the highest ever in our history, and trying to tie this bit to the funding, because a lot of prevention activity and kind of things you could do at scale is cost avoidance. But I think we know from your work that actually this is cash releasing, because you're not having to pay additional costs for temporary staffing, particularly true in the National Health Service, where the premium rates for locum cover can be 2 to 3 times the cost of having your normal member of staff in. I mean, is that a route that really could get to not just scale, but also the kind of funding opportunity to play back into some of the kind of schemes like Ben's and Daniella's?
Yeah, I mean, the question is the fundamental question. It's about how you scale and critically sustain this. Now, I think the interesting bit of feedback I give to the audience is that the work that we've done as Business Health Matters, in its entirety to date, in total, we've secured £7 million for it just in a sub-region of Lancashire. The funding has all been about economic development. The outcomes have primarily been around health. The benefits are primarily around physical and mental well-being. The cash, where it's come from, has not been out of the health system, it's been out of the economic development system. It's been from our European Union, and it's been from Innovate UK. And I think that says a lot. Now, when you talked about sustainability, well, you talked about well, fundamentally, we need to get into those conversations about system change. The wiring needs to change. So we have done a lot to create the capability and the appetite for workplace health through Business Health Matters on the ground. We are working really hard with our academic bodies and our partners to actually create that level of awareness and confidence that investing in workplace health creates economic and health outcomes. And that's not an easy argument and narrative to actually engage with, particularly for health colleagues, interestingly. It's easier for economic colleagues. So that has been extremely difficult for us over the last 3 years to actually gain some momentum there. But we are getting there. And I've got to say, in Lancashire, the work that we've done, and as I say, that work with the LEP we've been able to illustrate through the work we've done with them, £30 billion economy for Lancashire, £3 billion lost in terms of lost productivity due to poor health, 70% of that attributable to lifestyle disease, lifestyle choices, presenteeism costs, so people actually turn up to work, but because they've got poor mental and physical health, not being as productive as they could be, twice as high as the direct cost of health. So you're talking another £6 billion worth of lost productivity. We've actually been able to qualify those numbers with economic colleagues. And they're the people who've actually supported us now to include health and prosperity as a key cornerstone of Lancashire's devolution deal. Now that is system change. So when you talk about scale and spread, to a degree, it's irrelevant. It's actually getting it hardwired into the system with that narrative and the underlying argument. And I know that we're going to talk about that a little bit later on, about where does the return on investment actually appear in the system. But that's the bit that we've really had to work hard on. That's the partnership that we've had to create with colleagues in the economic development, so the LEP, the local chambers of commerce, the big employers, the partners that have got real issues with filling those vacancies. And just to be clear, 1 in 10 of all vacancies in the health system, so 1 in 10 of posts in the health system has got a vacancy in Lancashire. You know, it's a really big thing. So 1 in 4 of all vacancies across Lancashire in health and social care. So they've been saying to us, yeah, we understand this argument. We want to work with you to improve workplace health, so we're retaining people in that, in the workplace, and we're re-engaging them into those health and care posts. So that is the narrative that we've had to create. But scaling, it has been about partnerships, it has been with academic organisations, it has been with partners like UK Active at a national level, so that we're actually taking Business Health Matters beyond Lancashire now, and we're getting it into the eyes of national government, so that we are able to have those conversations about hardwiring this in. And ultimately, it's got to be driven by funding at a system level and with incentives right directly down to particularly SMEs to make this a viable option for them to engage in workplace health. And that is missing at the moment, Mike.
Okay, thanks. I want to sort of segue from that into one of the things, and you and I have talked about this, and you are absolutely all across this, is that very often workplace health programs that have been sort of put in place have a great appeal for the already active, and the people who you really want to get to very often are the ones who wouldn't necessarily participate, and the activities are not geared. And I'm conscious of Good Boost and actually your work at Holly Health, Daniela. You stressed in your presentation actually at the beginning the personalisation, the individualisation of that, and really sort of like trying to understand that. I mean, and of course we're all really frustrated by the fact that COVID revealed this huge inequalities in our system that we thought was one of the fairest in the world. So I just wonder a bit of wisdom from two of you about how do we get the kind of at-scale offer, the at-scale kind of messaging, but we do sort of relate that back to the person. And I'm wondering, you know, from both of your experiences, really, what lessons there are around not assuming that everybody wants the same thing, and you know, and does technology and the data give you a lot of insights into that?
Yeah, it's horses for courses. People want choice. We're all consumers within health and well-being, and the more choices, the better. What we've done in terms of making something that's a really true low-hanging fruit for a lot of our participants through Good Boost, the MSK hubs. Had a conversation with a leisure group in South Wales last week, and the feedback was finally something for people who found group exercise, even Tai Chi, too intimidating because the fear of having to keep up with everyone else, where even walking groups weren't a viable option because their mobility was so poor. And so having that level of personalization was so important. We're just doing our biggest ever data evaluation at Good Boost, and only 17.5% of our participants hit the CMO guidelines at baseline. So we're working with a really inactive population who do not see gyms or swimming pools as their environment for them, but they now do. And part of that is we've been working with the MSK hubs to put coffee mornings in as standard, where you don't go there before the activity. The coffee mornings is its own coffee morning independently. So people can come along, feel normalized that this is a space to meet people like me, and in 2 or 3 coffees later, realize that maybe I wouldn't mind going to the pool. Maybe I wouldn't mind doing something active. So it's about making people feel welcome to physical activity when that isn't part of their normal daily life. And that's been one of our biggest challenges. What we've used technology is to make sure in a group session, you can have any people with different conditions, different needs, different abilities, which is great because for our leisure centers we work with, they can have completely booked out classes because it's not one joint area or it's not one condition. It's great. The value is that it's the social and emotional support that people really value. So we train our facilitators, deliver Good Boost classes, how to have those conversations, how to make people feel welcome, how to create peer connections between people. Because what happens then is conversations between people, what they do to manage their condition, advice and guidance from each other, and feeling part of a supportive group. And we get told so often the key thing has been a reduction in improvement in mental health, reduction of isolation, which is not what we set out to do. But we've been able to make people feel that these are their spaces they can be active in and realize there's a community for them there. And that's been a huge part of our impact.
Brilliant. Daniela, your thoughts on this personalization?
Yeah, so I mean, personalization is one of the biggest kind of pillars of Holly Health. And we do use technology to achieve that. So when someone joins Holly Health, they go through a mini consultation with the Holly Bird, which is a little chatbot. And what happens is they go through, they can set up a goal of what they want to achieve, but it's also much more than that. So it's what are their challenges, what are they going through, their lifestyle, all of these factors can then impact what their suggestions are for them to start doing small actions. And that could be very different for everyone. So for one person, it could be doing neck rolls, you know, for 2 minutes, and that's great. For someone else, it could be going to a gym class. So it's all about finding what works for each person in their situation, considering mobility issues, medical conditions, accessibility. Even with the community feature, there's the option, okay, when we were kind of having focus groups and conversations with users about the community feature before it was launched, we were exploring, okay, would you go to an in-person class? And some people were like, yes, of course, I would love to know what's around in my community and be a part of that. But some people were like, no, I live in a very rural place, so that's really hard for me, so I prefer an online class. And I'm also, I'd rather keep my camera off. So yeah, as Ben says, it's about option. It's about giving people the tools to do what feels right for them at that precise moment. And that could be very different. Like what feels right today could be different from what feels right tomorrow, in 2 days, in a year. So it's all kind of adaptable support that people can then action based on their situation.
I'm going to be really mean again, Anna, by asking you a tough question. Ben mentioned it, and it did strike me that the Chief Medical Officer's guidelines, 3 times 30, moderate, high intensity, over the years we've moved them about, and helpful at one level, but are they, in some ways, are sort of like get in the way of people who might just do something, but they don't do that level? Really interesting whether or not that feels like as a message in the way that people kind of grab 5 a day. Is the messaging around exercise at national level tapping into this?
I think the fact that we know 5 a day, but we don't have the same knowledge of the physical activity guidelines. And I think the point that's been made very well here is in terms of tackling inequalities, the biggest benefits come from getting the inactive active rather than getting the already active meeting these guidelines. So they're there, that's great, and professionals hopefully do understand what they are. But I think that the biggest thing that we can do in terms of addressing inequalities is getting the inactive active. And so I'm really delighted, and it was something that the Challenge Fund really worked very hard to do, is to make sure that we really pushed around inequalities and kept that as a focus for the challenge, because I think it would have been too easy to have had lots of wonderful innovations about healthy aging, which were basically going to worsen inequalities because they would have just engaged with already engaged people and helped them to get even healthier and so on. So I think, again, credit to the teams on the stage here for really showing how to find ways of people who wouldn't otherwise engage in physical activity. I think the social, the evidence suggests that is a really good way in, but also this idea that we know that people have barriers to even going into gyms because they don't think they're for people like them. All of the people who work in the gyms, if they sort of see them all as young, so I know that UK Active have been looking about how do you change the workforce within gyms. So again, you might have some older trainers and facilitators. And it is all about people like me. And if you don't see people like you, either by age or weight or other things, you're just not going to go there. So I think that idea of really engaging a different group of people who can see it as something for them, and getting people, just getting people started is absolutely key to this.
Just one of the most profound experiences I had working in this sector was the first time I saw a dementia-friendly swimming session at Clissold Leisure Centre that was run by GLL. And in talking to the couples who were swimming, now it doesn't go anywhere near a CMO's guideline, but in terms of the experience, because a carer and somebody being cared for in the water, swimming up and down, and one of the carers said to me, it is like we're teenagers again, and it's the only time when we just relax and we are who we always were. And you have tears in your eyes, but it's just really interesting that experience is as much a part of this story as the high intensity workouts that we have, I guess, and that deals with one of the questions. Adrian, I'm going to ask you a question about the sort of connection locally with the offer that's made from what people need, because if we're going to have an at-scale ability to respond, but we're going to do personal, that has to be quite a smart way of working, and that kind of tailoring. Sometimes it's about culture of the providers, and we work hard to make sure everybody feels included, as Anna and Daniela have talked about. But is there something about using, for example, social prescribing as a vehicle to sort of try and systematise these kind of routes in to service? And I know Active Lancashire do a lot more than just your Business Health Matters, and I'm just thinking how that's playing out in your area, really.
We're still very much on that learning journey, if I'm honest with you, Mike. We're still learning more and more about what actually activates individuals and communities. So we're really developing that offer. We've come a huge way in terms of being able to break down those barriers, everything from the receptionist, you know, at a leisure centre, and how they engage with people who are from different backgrounds and have got different expectations and look differently from your standard users, right the way through to how we're actually going to be working, particularly in a peer support way, to engage people to become physically active and get them on that precognition about this is an opportunity and it could work with them. And it's about empowering people. It's all right engaging people and giving people the data. We were discussing this in the previous session about things like smartwatches or health checks, giving them the numbers. But what does that actually mean to them in their lives? And then how are we actually going to create credible pathways for them to actually become more physically active and to improve their health in a sustainable way? And so that social prescribing, we've had to work with different partners. We've got some great partnerships with Mind, the mental health charity. We've been working with older people's charities and voluntary sector groups, and I'm so glad to see so many of them here today. We've had to do a lot of work with our leisure service providers so that they're actually engaging with people in the workplace and on site and out there in the community, which they wouldn't generally have done previously before. So we are still much on that learning journey. We're still developing proactively what this will mean to people credibly so that it's an offer that they're going to engage with it. And I think we still haven't cracked that, if I'm honest with you, Mike. I think that's something which we still need to invest in and continue to develop our understanding with our communities.
Brilliant, brilliant. Listen, we've got about 3 minutes left, and I'm going to be even meaner than I've been so far with my questions. We have an election at some point next year. Yeah. You've got 30 seconds each. What is the one thing that you would say, irrespective of party, you would want to see coming out of our discussion that would make a difference in those next 5 years? What would you like to see from our political leadership going into next year? And Ben, I'm just terribly sorry, you're going to be my first. The others have got time to think. One thing, 30 seconds.
One thing is, Sport England announced in the last week about the investment now into communities to level up, to make sure people who have to face the highest inequalities have the greatest support being given to them. I think the thing I want to make sure from the next election is that the government commits and stands by that and probably rolls it out, because that's the most important thing, as was said by Anna, that it's the inequalities that affect people most, and people who have faced the highest inequalities are often the most inactive, and that's how we can create the greatest impact.
Brilliant. Thanks, Ben. Daniela.
I'll be very fast. Investment in prevention.
Okay. Very good.
So if I can have both of those already, so
yeah, you can lock those in.
Lock those in. Then I do think there is something about continuing to see ageing and healthy ageing as critical to economic success, whether it's part of an industrial strategy or, you know, keeping this focus on helping people to be productive and economically active. So keeping that focus on ageing and healthy ageing.
Thank you. So I'd agree with all those. And my biggie, and it really winds me up, it's planning policy. Active by design, 20-minute city, whatever we're going to call it. That is something which we could implement at scale tomorrow. The guidance is out there. I don't really understand why it's not taken off, and I think that's the stuff which could be meaningful for the next generation. It's got legs as a policy.
Brilliant. Well, listen, let me just sort of draw the session to a close with a couple of thoughts. One, again, to thank you for participating. There are a number of questions I didn't get round to, but hopefully I picked up some of the themes in those questions in the conversation. I mentioned right at the outset this idea of a jigsaw with pieces. Many of you will sit on one of those jigsaw pieces. Going to Anna's theme of partnership and that's come through the day, if you are sitting on one of those pieces, please reach out to the people around you. Certainly from a UK Active point of view, but I know from all our colleagues that, you know, we're very keen to help sort of make those pieces, because really the trick is about systematising what we already know is working and then managing that at scale as a lever to sort of bend funding into more of the work on prevention, as colleagues have said. The other theme for me, which is about ourselves, I always like to think about what do I take away, not just what my organisation takes away. And the thing that I'm constantly confronted with in the work that I do is the number of people as they age who take for granted or believe that any conditions or aches and pains that they've got are inevitable. And it's something that, oh, well, it's because I'm getting old. And so often, that activity that starts to address that surprises you and makes you understand, actually, it's not, I don't have to accept this is my fate. If I can do something about this to keep myself slightly more active, I can usually get over that hurdle, and then I'll feel as good as I did last year before I thought this was a condition of age. So there's something about our own understanding of ourselves that says, if in doubt, let's give it a go and let's try and find some way to sort of maintain our health. So the final word, just to say from a UK Active point of view, and to thank colleagues for inviting us to sort of chair this session. UK Active is a sector which represents public, private, independent, a whole raft of people, and as I was mentioning before, not just people who look like they're there to sort of like lift weights all the time in terms of that sort of younger sort of image that we have. So many of our facilities are given over to multi-age and are very much tailored to different groups, different people, including increasingly, I'm pleased to say, diversity, inclusion, etc., in terms of culture, background, etc. So if we can be helpful in any way, please do get in touch with us, love that. But I'd just like to end by thanking the brilliant panel and yourselves for attending, and thank you, Go. I think it's lunchtime now. Enjoy your lunch.